Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is low glycemic benefits. And if you watch any of my videos, you know that I like to talk about eating a low glycemic diet a lot. So sometimes it gets a bit repetitive, but I think sometimes just hearing slight variations on the story can keep you focused on staying on a low glycemic eating plan for the long run. And so the big benefit for low glycemic eating is the reversal of insulin resistance. I saw a patient yesterday who had, after a few years of kind of goofing around, not really doing anything seriously, decided to finally follow a low glycemic eating plan because he was inching closer to becoming diabetic, and he was going to need a second blood pressure medicine because his blood pressure was high. So he decided to follow my usual low glycemic plan, which I call the modified plate. And these are the things that happened in 1 month. He lost 13 pounds, and his blood pressure dropped from 150 over 108 to 120 over 82. Now, he was exercising a little bit. He wasn't following my usual recommendations for exercise at this point because the weather isn't very nice and he doesn't like to exercise indoors. So this is all achieved just from dietary changes. And this is, I wouldn't say typical, but it's common. Typical, it's hard to say what's typical because there's so many variations. People lose weight, sometimes slowly, sometimes very quickly. He's kind of in the middle of the road. I've seen people lose 20 pounds a month following this program. And so his 13 pounds was good, considering he wasn't following it completely. He was about 80% to where I recommended him to be. A couple things he just didn't want to give up, but he gave up so much of his high glycemic stuff that it started to significantly reverse insulin resistance with the significant drop of 13 pounds and a significant drop in his blood pressure. But more importantly, the thing we can't measure is his insulin resistance is decreasing, the main driver of calcification of the coronary arteries. And so the main driver biochemically that's pushing him towards a premature heart attack or sudden death, he has started to reverse finally. So hopefully he'll stay on path. I hope this helps you to stay on path. I wish you well. God bless and have a great day.